Hey brothers, this is Patrick again. I told you I was going to give you an update. Finished the part 1 of my gastric bypass. The last thing I was talking about is the weight that I lost. I lost 100 pounds. And I lost that weight, which I was saying, very fast. And it was like within a month and a half, I lost 100 pounds. And it wasn't because of the surgery, it was because the complications after the surgery. I would have lost it a whole lot slower if I was healthy after the surgery, if I didn't have all those complications. But I did, so that's why I lost the weight so fast. And that's why my protein depleted as fast too, because everything just happened like real fast. And so it just put me on a spiral that was just going down. And like I said, hopefully this may help somebody else who's out there thinking of having gastric bypass or something else. There's the sleeve and there's also the lap band. The sleeve is a little bit more better to my understanding, but the best one is to have is the gastric bypass, just as long as you don't have all these complications like I've had. Let's see what else about that surgery. I'm still on it. This is August 2011. Next month, September, will be a total year that I've been having complications for surgery a year ago, September 7th of 2010. I'm still having complications. But hopefully this last surgery I have, I'm praying that it will be my last one as far as this, as far as complications toward my gastric bypass. Like I said, she's going to cut open where I have the fistula and sew it from the bottom and bring it up to the top. The reason she told me she didn't do it before is because she wasn't really sure. They take x-rays and they do CAT scans and they do all those things of it, but you really can't tell until you're really in there exactly where it is. So when she went in, they went in and tried to do this other procedure that didn't work the last time. That's when she really realized where it was, and where she said, well, I could just go in there and cut and sew it up, and then I won't have such a large cut down the middle of my stomach. I had a incision from about the top of my rib cage down all the way past my belly button. That's how far I was cut open. And she didn't want to cut me that far again and maybe develop another fistula behind that. So that's why she said she'll just make a small incision and try to cut it open and then sew it from the inside. And then right as I'm on the table, they go ahead and fix the hernia and have plastic surgery come in and put my muscles back together and give me a tummy tuck. So I can get all that done at one time, and hopefully that should be my last surgery there. My surgical procedures and everything I'm going through is through the VA, Veterans Hospital, because I'm a disabled vet. So all these things that happen to me, not necessarily saying they won't happen outside of the VA, but I think the competence of the doctors at the VA is not as high because there's not a lot of suing that you can do within the Veterans Administration or whatever you want to call it. And I do have an excellent surgeon. I mean, there's been some complications, but she's an excellent surgeon, and I would trust my life in her hands anytime. Like I said, I lost it twice, but she was able to get me back and everything. And that's the scariest thing about surgery is when you sleep, you don't know if you're going to wake up or if you wake up or not. You just know when you wake up, it's done. I mean, when they put me to sleep, I didn't even know I was falling asleep. I guess I've had so much anesthesia now, I just go out, I guess. But I don't know when I'm asleep, and the only thing I know is I'm awake and everything's done. And my protein, like I said before, my protein was down the last time. That's why they're kind of waiting on the surgery to bring my protein back up, and hopefully in a couple of weeks I'll be able to have this last surgery, and get that done. And then after that, maybe 3 or 4 months later, they'll be able to do my top surgery. And the only reason why the VA is able to do those things is because I've had gastric bypass. If I didn't have gastric bypass, they wouldn't be doing like top surgery or tummy tuck or anything of that nature. But it comes with the layout of having gastric bypass. These are the things that you can get afterwards to make your life, a little bit better. I also did it because I have a lot of back pain. I have fibromyalgia, and thinking that once I lost all this weight, that it takes some of the pressure off my back, because I was a big guy, but it really didn't help. I thought it would, but fibromyalgia is fibromyalgia. You have it, and it's not gonna go away. I do take medication for it, but when you have pain, the pain's always there, and medication is not always the thing that's gonna make it work. But that's something I have to deal with too. So now that I'm done with that, the surgery's done. My gastric bypass story is done. I hope that it can help someone out there. Make sure you talk to doctors if you do decide to go that way. Make sure you get, every type of information that you can. Make sure you have a will, because you don't know what's going to happen. Make sure the blood types and all that stuff is correct. I had my doctor stand there when I got the blood infusion. I had her stand there. Because there's so many things that can go wrong with getting blood. It has to be given to you at a certain rate. It has to be ensured that your blood types match. It has to be ensured that the dates are right on it. It's not expired. You try your best, but you're still not sure if there's anything that can be caught. They're able to filter the blood as good as they can, but there are still some things that can still be passed on through blood. So all those things, if you get blood, that was my main thing of not getting blood, because I knew there's not enough known about blood to say, just give me blood, it'll be okay. Because I know the difficulties of blood. I was a nurse in the military, so I knew the wrong things that could go wrong with blood. Getting the wrong blood type, pushing it too fast. I knew all that stuff. Being not able to take it, reject it. It's a lot of things that can go wrong with blood. And then you still don't know, they still don't know all the things, that blood carries and what you can catch. So you got to be real careful when it comes to blood. And then basic Bible principles. Religion which I was affiliated with does not allow you to have blood transfusions. And I'm not affiliated with it anymore because of my lifestyle and the way I wish to live presently. It kind of hurts sometimes, but I have to find out who I am and what I am before I can go any further with that. But enough about that said. Let's see what else. So, back on a happier note, I'm glad to be back. I'm glad to be here. I'm glad to be able to tell my story. I'm glad to be able to see my family every day. I'm glad I'm still married. My wife has been there. Anybody could have, with the complications and the hospital stay and all that, could have just walked away, very simply. And I've even pushed her away very simply, but she's still here. Because it gets you in a state of mind that, this is too much. I can't deal with it. That's where I had gotten at. Because there was so much, and every time I turned around, there was a complication. Blood wasn't right, or this wasn't right, or something was going wrong. And it was just really eating at me, and I would take it out on the only person I knew, and that was my wife. Let's see what else. Like I said, glad to be here. Glad to be able to talk to you guys again. Now, as far as SRS is concerned, I plan on going. I've done some research, and I plan on going to Europe. I forget. I asked you guys about one of the doctors there. Provost, I think it was. I can't remember his name right offhand. But this is the only doctor that I've seen that, besides in Bangkok, but they can't do what this, all the way through what this doctor can do, is that they're able to do everything, you know, just like a regular SRS, metodioplasty, all that. But they are also able to give you a penile implant with you still having sensation, feel the engorgement, and feel like you're having an orgasm, you know, like you want to jerk off or whatever, you know, whatever they want to call it. But he's the only one, and then with that, able to give you as much length as up to 7 inches. And I'm not trying to be huge or anything, but there's no other doctor anywhere that I've seen that can do what he does. And I've researched quite a few, and I've changed doctors quite a few times until I found this one here. And I think I'm going to stick with them. I call them, they are expensive. They are very expensive. So that's something I'm going to have to save on top of save. Because I don't work. Like I said, I'm a disabled vet. So I get a certain amount every month. Of course, it takes care of all my needs and everything, and my children, my wife. But I have to do something to be able to put some away as well, so that, like I say, for my SRS, still take care of my family in a manner that I wish they were accustomed to. Let's see what else. So hopefully in a couple of years, 2 years at the most, I want to have my bottom surgery. I think I could do it within 2 years. And I have my bottom surgery, and then that'll be it, because everything else will be done. And my next video, I'm going to be talking about having my exercise program. I found a nice guy on the internet, and I've been working out with his, and I can see the difference, a real nice difference. I can feel the soreness, so it shows me that it is working or it's doing something. And so my time is about to run out again, and I don't want it to run out on me like it did the last one. But so that'll be my next video. I'll be talking about that. But if you guys have any other information, if anybody's heard of that doctor there in Europe, please let me know. If you have any experience with him or anything. And you guys, stay good out there. Stay cool. Take care of yourselves. Take care of your family. And keep in touch. And this is Patrick. I'll be talking to you guys again. Take care.